This video was produced to demonstrate the collaboration of an interprofessional team at St. Francis Eastside Hospital in Greenville, South Carolina. This team has been assembled to evaluate the current perioperative process of a patient scheduled for a D&E due to a miscarriage. The goal of this collaboration is to improve the health care services received by a woman having a miscarriage at St. Francis Eastside Hospital. We now join the meeting about to begin. We begin in the chapel conference room at St. Francis Eastside Hospital. It's 4 p.m. on Tuesday, April the 7th, 2015. The members of the D&E task force have arrived and the meeting is about to begin. Good afternoon. My name is Amanda Hightower. I'm a registered nurse in pre-assessment here at Eastside. I will be the facilitator for this task force. I've invited each of you here to look at our current process for D&E patients and to improve this patient population's experience here at St. Francis. I make phone calls to these patients to perform an assessment prior to surgery. I am a pre-assessment nurse. Over the past several months, I've experienced more and more women crying and being emotional during my phone assessment. I've had people crying at me. I've had angry husbands cursing at me, wanting to know why I'm calling his wife. I want to know why all this is necessary. And I've also had my peers in the pre-assessment department, other nurses, reporting similar experiences. It's not only stressful to these patients, it's stressful to us as RNs here in this department. The pre-assessment department nurses know that we are a caring hospital, and we say that we are a good help to those in need. But right now, we think we're adding to these patients' stress and not being very good help to them. The goal of this task force will be to develop an improved process for these patients where we don't have to contact them prior to the day of surgery. I would like to begin by going around the table and having each of you introduce yourselves, your title, and the area you work in here at St. Francis. Angie, let's start with you. Hi, my name's Angie. I'm the supervisor for registration in the business office here at Eastside. Hi, my name is Kim. I'm the physician liaison with the OBGYN groups at Bishi. Hi, my name is Cindy. I'm the bereavement counselor and chaplain here at St. Francis Eastside. Hi, my name's Shelley. I'm a pre-op nurse at Eastside. I'm Julia. I work with Amanda in pre-assessment. I'm a registered nurse. To begin our discussions, I would like to have each of you discuss the current process or issues you're seeing with your D&E patient population. Just to let you know, I have done a literature search on perinatal bereavement, and I have found evidence in the literature that says that how a healthcare team supports a woman experiencing a miscarriage affects how she copes with it and also how she recovers from it. So this is a very important task we've been given. If you would like to read the research, I will be providing a list of resources in the meeting minutes that I'll email you later. My resources were the Nursing Standard Journal from June of 2012, ER Journal for ER Nurse 2009, and the Journal of Reproduction and Infant Psychology from August of 2010. Angie, let's begin with you. All right. Being the supervisor of registration in the business office here at St. Francis, sometimes I have to call these patients too if I'm short-staffed, and I've actually kind of had some problems also. The issue that I have, or our department has, that these patients usually pre-register for the labor and delivery unit and the admission for the birth very early in their pregnancy. Some women are coming in and pre-registering as early as 6 or 8 weeks. So we already have a business office account with the labor and delivery department. The problem is our labor and delivery accounts are not linked to our ambulatory surgery accounts. L&D admissions are just that. They're direct admits to the hospital. And our outpatient ambulatory surgery accounts are outpatient, so the two are not linked right now. So when a patient comes in for a D&E, the system does not notify the L&D department that they've had a D&E for that same pregnancy. The business office then sends out prepayment notices, not aware the patient has had a miscarriage. And this has happened on more than one or two occasions. It's becoming a problem. So for me, I would like to have an IT person or a Connect Care representative be on this task force so we can look at what options we have as far as our electronic system and linking it to the two areas. Angie, I was not even aware of such a problem. That is terrible, and I will definitely contact our IT department. I'll also send an email to the Connect Care rep, and I'll also send a meeting request to them so we can get somebody here with our next meeting. Kim? Hi, I'm currently the physician liaison for 3 of the 8 OBGYN groups here at St. Francis. The 3 I work with are affiliated with the hospital. They're actually Bon Secours employees, so that's why I work with them. Like I said, there's 8, so there's 5 OBGYN groups that are not represented. I would be willing to roll out any changes we make in this task force, and then I would be the contact person if you'd like for me to be. I'll be able to notify those other groups and keep them abreast of any changes and updates, and be willing to coordinate that with them if you need me to. Thank you, Kim. That would help a lot. I appreciate your willingness to reach out to the other groups and be our connect between the two. Cindy? As the bereavement counselor and bereavement chaplain here, I see all these patients pretty much. I think we also need to include an ER staff nurse on this task force. Not all these women having miscarriages are actually scheduled to come in for a D&E. We're seeing a large amount or large volume in the ER of miscarriages, and people, the women are being sent back home to deliver or miscarry, and they're not requiring a D&E. So I'd like to have that group in here. Oh, that's so true, Cindy. I haven't even thought about that, but you're correct. Not all women having a miscarriage require D&E. I'll definitely be in contact with the director of the ER and have them send someone over to our next meeting, and I'll send a meeting request and an email also. Thank you. Shelley? Well, I think we do a good job in the pre-op area caring for these women. For me, it is kind of difficult knowing exactly what to say to them sometimes. And also, it's difficult to know just how to provide that emotional support they need and to give them time and spend time with them while they're in the pre-op area. I usually have 1 or 2 other pre-op patients that I'm trying to get, ready for surgery, and not necessarily D&E patients. So it's kind of hard too, switching back and forth between the types of patients and trying not to be bubbly when I walk back in the door in the woman having the D&E. So I'd like to have some more education. In nursing school, we really wasn't taught a lot about how to deal with bereavement, especially the loss of an infant or a miscarriage. So I'd like to see maybe some education for that. Shelley, that is an excellent suggestion. I think we all, as nurses, like you said, we don't have a lot of experience with the bereavement, so I think that'll be excellent. I'll get in contact with Jenny, our nurse educator, and see if we can't pull something together. I'll see if we can't offer it to all the perioperative department. That'll include the recovery room and the OR staff, pre-assessment and pre-op. And I'll also reach out to the ER staff to see if we can include them. Amanda? Yes, Cindy. I would be willing to help Jenny with that coordination and doing the in-service on bereavement. Thank you so much, Cindy, for being willing to help. I'll let Jenny know, and I'll have her contact you. Julia? Well, like I said earlier, I do work with Amanda in pre-assessment, and just so y'all know, these patients are very emotional, and it's difficult for the patients as well as the nursing when we're talking about this. The D&E patients are usually scheduled in the OR within 24 hours of hearing about the news. Typically what happens, the woman goes to the OBGYN for her first ultrasound. She's happy when she gets there. Then she's given the information that her baby has no heartbeat and she needs to have a D&E. These women are devastated. The MD office automatically calls the OR scheduling department and adds on the case for the next day, or sometimes the same day, but usually it's the next day. OR scheduling calls the pre-assessment department and tells us we need to do a phone assessment. Pre-assessment nurse calls the patient the same day, sometimes within hours of receiving this news. What happens, the patient's scheduled for their ultrasound at 2 or 3 o'clock in the afternoon, and then we have to call them and get the information before 5. It's just terrible. All of the pertinent information we need's already been handled by the doctor's office. All we really need is a list of their allergies, their medications, and their history. And most of these women are less than 40 years old and very healthy. These patients are very usually emotional. Sometimes their husbands answer the phone and they scream and they curse. I just think it'd be better for everybody if these patients were just seen the day of surgery. Thank you for describing our process, Julia. You're correct. I would just like to add that I've already discussed this with the our supervisor in pre-assessment and the head of the anesthesia department. Anesthesia is in full agreement with having these patients assessed the day of surgery, so they said it would be fine not to do a phone assessment. I would like to thank everyone for coming today. We have really accomplished a lot, and we have identified a lot of areas that we need to work on. Identified are the electronic communication system between the business office and labor and delivery, the communication difficulty with non-BSHE OBGYN groups, the need to include the ER staff, the nurse educator, and the need to change our scheduling. When the MD office schedules a D&E, they just need to schedule it the same day of the procedure, not call pre-assessment for a phone assessment. I will email everyone with the meeting minutes from today. Our next meeting will be on Tuesday, April the 21st at 4 p.m. in the same location. Thank you for your attendance and your help. We are dismissed. Well, as you have been able to see, this task force is very organized and has good open communication skills. According to Sharon Vincent in Chapter 8 of the book Role Development in Professional Nursing Practice, all members of the healthcare team must combine their skills, knowledge, and resources to improve outcomes. The purpose of this task force is in direct alignment with her definition of the purpose of a collaboration, which is to achieve the high-quality patient care and satisfaction. It will be exciting to see how the interchange of ideas and the formulation of a new process impacts this patient population at St. Francis. Please stay tuned for further developments. Thank you.